Hello, everyone. I'm Cheryl Hicks. I'm the Executive Director and CEO of the Toilet Board Coalition, a business platform for sanitation. And we are building the sanitation economy, which our members believe has the potential to transform sanitation systems from unaffordable public costs into sustainable and resilient business solutions, but also new solutions, alternatives for sanitation for communities and cities and governments. And we are starting this series of YouTube chats with our members. The Toilet Board Coalition has 50 members, many of them who you will know. And today we have with us John Sauer from PSI, Population Services International. John is an expert in sanitation, working in the space for many years, and has been working with us at the Toilet Board Coalition for I think the past 3 years now, John, and has been at least and has been involved in the work that businesses are doing. And so John, from your perspective, as a sanitation expert, really want to hear your views on how you've seen business evolving, or these solutions for sanitation coming from business. How are you seeing these solutions, changing the space of sanitation, and what are you most encouraged by, and what are some of those models that you're most excited about?
Great, thanks, Cheryl. That's a great introduction, and a pleasure to be here. I mean, my sense is that this focus on cities as a scaling strategy that's in the new Toilet Board Coalition documents and strategy is really where we're seeing the most synergy. We know that cities have different market segments, and that the needs of those segments vary quite a bit. And we're, at PSI, interested in finding solution for those various segments of the market that enable those consumers to have the highest level of sanitation service possible. PSI's priority is to know those segments and what they need, and to facilitate that they can afford and have access to the services and solutions that they want. In many cases, it will be Toilet Board Coalition accelerator members and other business partners that can provide those services. And PSI is a market facilitator, and in some cases a social enterprise. We do play that role in other health areas. In one place in Ethiopia, we want to support the development of those technologies and the business models suited to address those different segments. So, and as you know, this can be new service delivery models, safe for communities with high water tables that currently don't get served with any type of sanitation solution. It could be better public toilet management. It could also be the better organization of emptying and treatment services, and of course, much more.
And what, over the last 5 years, what shifts have you seen, again, that you're most encouraged by, where business and NGOs and governments have been working together on these solutions? What's most encouraging in that shift, and how's it being taken forward?
I mean, I think the biggest encouragement is just that we're starting to take the role of the private sector seriously. Where PSI, we're an organization that has always worked with sort of private sector models and with the private sector quite a bit, especially in other health areas. And so seeing sanitation really embrace that the private sector has a really significant role to play, and one that's frankly been ignored, is to me the most encouraging. And that's why we wanted to really be a part of the Toilet Board Coalition and help contribute to helping it grow and provide our services and our role as needed to make that happen.
Fantastic. And with COVID-19, a crisis on hygiene and a new focus, really a new normal in terms of hygiene and preventative health, infection control that we've ever seen. How are you seeing this new environment really affecting your work in sanitation, or what are you seeing now, and what are your views on how this will change?
Yeah, Cheryl, as you said, COVID-19 is really putting a spotlight on hygiene issues, and the need for improved products and services related to different customer segments. For example, youth, migrant workers, people living with HIV, and many other segments that often don't get highlighted or supported. So, this is a really good shift of focus to A, on hygiene, because that's also one of these forgotten areas a lot of times, but also to really look at these segments that don't often get the products and materials that they need to practice the right kind of hygiene behaviors. And also, there's this look at all different types of locations, healthcare facilities, schools, work environments, public spaces. There's this highlight that all of these people in all these locations need adequate facilities and equipment and materials in place. I think it's also highlighting that appropriate social behavior change messaging and approaches are critical, and that we do need new ways of delivering those messages that resonate with different market segments. That those pieces are important and required. I think we're also seeing we've known, and Cheryl, Toilet Board Coalition has been an early leader in this, in sort of highlighting that digital approaches are a really important part of this, and I think we're seeing that those are becoming more prevalent, especially in this COVID work. The use of social media and other digital tools and platforms are becoming more important, both in delivering social behavior change messages, but also in connecting consumers with adequate products and services. And we plan to push that even further and push the envelope on that as we continue our work.
PSI and many of the really large impactful organizations, yourselves, WaterAid, UNICEF, have been implementing at speed new programs around hygiene. And what's sort of your view on how this is I think changing the approach of the global development sector around sanitation and hygiene, and where do you see the best role for business in that in that new force?
Yeah, I think business is, they're the partners that we turn to first to try to, figure these things out, especially around the innovations around products and services. Unfortunately, I think that there's, both in sanitation and in hygiene, there haven't really been a lot of innovations, especially on the R&D side, to really provide these lower cost products. I'm really encouraged to see some of the work. Again, Lixil has been a leader in this and continues to be, and they've just recently done some work to develop this new hand washing, very low cost hand washing station. I mean, these are the kinds of innovations that where have they been all these years is the kind of the question. So it's great to see that they're kind of coming into play, because otherwise there's always this disconnect, right, between the social behavior change messaging and the fact that many people just don't have the materials and products that they need to practice these desired hygiene behaviors. So we need to do this and do it more quickly and put more focus on, especially on the R&D, and really resource that. I mean, that's something that's just been.
It's really interesting what you say about innovation. I think one of the amazing things that we've seen in sort of the community building that's been happening around COVID for small businesses in water, sanitation, and hygiene, and in our portfolio and network. And I think you probably heard this on our annual member meeting webinars a couple of weeks ago, but we are seeing small businesses innovating as well around new hygiene offerings, and we're hearing from those businesses that that is the new normal, and it's no longer acceptable to have a wash solution without hygiene and access to hygiene and hand washing being explicit. I think it's been implicit in many ways, but making it explicit. And I think that's really encouraging.
Yeah, and we've frankly been making do with products. There there is some manufacturing sector, like in Ethiopia and West Africa, where there are hand washing facilities, but they're not quite, consumer friendly enough. They're not quite, like affordable enough. So there's definitely innovation to be had there. And one other thing I did want to mention, about this sort of COVID era is, it's also encouraging to see this very specific priority being placed on water, sanitation, and hygiene in healthcare facilities and on infection prevention and control. I mean, this is, Cheryl, just so critical given that 1.5 billion people are going to health centers with no toilets at all, for example. So we need to put that attention and focus on the healthcare facilities and service providers and make sure that those institutions are able to improve and maintain the facilities that they need so that their patients, their staff can practice good prevention behavior.
No, thank you. And infection control, it's interesting. And we've been talking about this with many of the members and getting their views. So we'd love to hear your view on this, John. It seems there is this new normal. So I think even hygiene practices pre-COVID and hygiene practices now and in the future are different. I think that the prevalence of protective gear, the social distancing, how are you and your organization sort of thinking about that? It feels like not only do we need to provide more solutions that we've known about, but we actually need new solutions, and really around infection control, including businesses and the new responsibility that they have to protect their employees and the communities where their employees are living. How is the PSI sort of thinking about this new definition of hygiene and responsibility of employers, for example?
I think you've sort of said it. I think the first step is really knowing what the situation is, and there again, this goes back to the digital piece. A lot of institutions, frankly, don't, or let's say the leadership of those institutions, they don't really even know the status of this infection prevention and control issue. So it's making sure that that good sort of standards are put in place and that they're monitored effectively, and that when there are problems, there's ways to address them. But yes, I think the other piece is those solutions are, and we've seen this with, in schools, the facilities that get put in place are not child friendly. They're not, user friendly for children. They don't include nudges and other types of cues that allow students to, remind themselves that they should wash their hands, for example, after using the toilet, if those facilities even exist, because a lot of times they're put in place and they break down, they're not replaced. So I think there's this whole need, and like you've seen, like organizations like Splash, they've done a lot of work on the school side of really creating these facilities, hand washing facilities in particular, that really, that work, that are designed to last the school environment, and I think we need more of that type of innovation, frankly, and then to scale that, and I think and that's going to be through the private sector, right? Like the private sector is going to have to support that scaling. Maybe not, at the innovation level, maybe that can happen at all different levels, but the scaling piece is going to be the manufacturing sector and the distribution sectors locally in country that are going to really make that happen. So we've got to provide the products that really resonate with those types of institutions, so that they see they also need to see the business sense of it. And that, I think, is something we've also failed them at, frankly, providing those products that allow them to see the volumes they want. We've talked to a lot of national distributors and manufacturers. They want to see, minimum 1,000 volume per month moving to get interested, and most programs don't allow that at all. So we've got to change the dynamic there.
More, faster, bigger.
Yeah.
And, we, and part of the reason for this video series is really just to make available these solutions. And so we will, you mentioned Splash, but we'll put that up, on our YouTube channel, direct people. I think, we just need
Yeah.
more awareness that there are solutions that can be
Happy Tap's another one, which I
Happy
think you
Taps.
guys are aware of, right? So,
Yes,
yeah.
yes.
But there needs to
Fantastic.
be more, like, and
There does.
probably things are happening. Like I got sent a new device the other day that, but we those have to be vetted and they have to, so there's a process to it, but frankly, the private sector really should be leading on this.
Yes, yes, thank you. So my final question for you, John, is about the future outlook. And you mentioned digital, and I think the U.S. and some of the technologies also that we've been supporting at the Toilet Board Coalition and testing for how sanitation systems can really add value in terms of health prevention and monitoring through these new digital technologies. And I think the U.S. was the first to have biobots, robots in the wastewater systems of 100 cities in the U.S. So can you talk about the new acceptance of these new digital tools? I think when we talked about smart sanitation in the past, it's felt like it was something in the future, and now the future is today. Can you comment on what you're seeing in terms of new acceptance of smart sanitation?
Yeah, actually, I think I mean, I'll leave it to the other TBC members that have a more specific focus on some of these, like these bots. But like I think we're looking at it from more of a from more of a social behavior change and marketing point of view, because that's our focus. How do we use these digital technologies to really understand what the consumer really wants, what their challenges are, and then fill those gaps, right, with with the kinds of products that they want and they need. But I think building on that, I mean, I did want to highlight sort of this opportunity that I think we do need to pay attention to, which is again around this human right issue that I know you guys highlight quite a bit, and really the sort of toilet economy issue. I mean, for example, in sub-Saharan Africa alone, there's still over 100 million households that lack access to basic sanitation. And progress is really at a standstill, Cheryl. It's just not keeping up with the population growth. So in fact, a smaller percentage of the population in many sub-Saharan African countries have basic sanitation now compared to 10 years ago. And we know, like, for a family, having this hygienic toilet is really a first step on a pathway to improving child and family health. This also creates jobs and economic opportunities. So I feel like there's a big opportunity here in this kind of post-COVID time for the private sector, especially local private sector, like these national and regional distributors that we talked about, to enter the toilet economy and reach these customers at the base of the pyramid. So I think, if a renewed focus on that right now, and what are the products that are really needed or are important. And then the last thing I really wanted to say to all the other Toilet Board Coalition members is I think even though the Toilet Board Coalition is all about partnership, I think there's still a missed opportunity through partnership to drive some of the innovation and scaling that we need. Unique, non-traditional partnerships are needed, kind of between NGOs and private sector, between government and private sector, between private sector to private sector. I think we need to explore and ensure support for all these kinds of partnerships and all these different types of options to completely maximize the strengths, the skills, the footprints of all these different players that do have something to bring to the table. And only when we sort of see these partnerships and these kind of different partnerships that maybe we haven't seen take shape or place yet will we kind of see the change that we're really trying to get at. So I'd really push that. I know partnership is a big part of the Toilet Board Coalition, but I really highlight that. Let's think of unique
New ways
partnerships
to
and
partner
new ways. And and
and
we've been
more
starting some of
efficiency.
those conversations with different Toilet Board Coalition accelerator members, but it's hard. Like it's hard to really.
Yep.
We know there's something there, but like it's gonna take some more like support, some more brands, to really figure out how to maximize those in a way that can change the game.
Absolutely. Absolutely. Thank you, John. Hearing clear
Yeah.
messages on innovation, needed for our new post-COVID world, and spotlight on hygiene and sanitation, facilities, healthcare facilities, and schools, and your last point around new types of partnerships. So, thank you.
Yeah, my pleasure. Thanks so much for
Stay
including
safe.
us in this.
Namaste.
All right, namaste to you too, Cheryl. Take care.
Thank you.